Hi, everyone. Welcome. Welcome. Hospice Nurse Julie here, live at 5. I had to restart because my computer and camera weren't hooked together. So I am back. I hope everyone can find me here. And I'm going to give it a few minutes for things to kind of start kicking off. And then we'll chat. Hey, Megan. I know. Was it hard to find me? I had to go on and come back on. Go off and come back on. Per usual. I'll figure it out one of these days. Hi, everyone. Welcome. Welcome. Sorry if I keep confusing everyone. I will not always do that, I swear. So when I'm looking right here, I'm looking at you guys into the camera. And then when I'm looking like this, I'm reading the comments. Okay? So Hospice Nurse Julie, in case you're new, I'm a hospice nurse who talks all things death and dying related, hospice related, palliative care related. I'm always live at 5 every Wednesday on YouTube. So welcome. And hello, everyone. We are worldwide tonight. There's someone from Toronto, Wyoming, Arizona, Ohio. Megan, my favorite, is here. Hi, Megan. Thank you for always supporting the channel. Thank you, everyone. I appreciate you guys so much. I'm sorry I kind of confuse everybody with like joining the live and then going off the live because I'm trying to make sure my computer or my camera is hooked up so you guys get a crisp image of me. Look at my laundry's in the back. Hey, tune in next week, by the way. You guys will hear this first. Tune in next week. There will be an announcement. An exciting thing you might want to hear. Yes, please feel free to tap that red heart in the bottom corner. I believe that helps my lives. I really appreciate it. So welcome, everyone. Come on in. Like I said, my name is Hospice Nurse Julie. I'm a hospice nurse and palliative care nurse. I educate all things death and dying and try to answer your questions. I'm live at 5 every Wednesday. And I am in California, so this is Pacific Standard Time. Okay. So let's get started. Oh, thank you, Vicat. I'm sure I'm saying your name wrong. It's like V-I-C-A-T. Hope you start feeling better. Someone is from Australia. Hello, you guys. Thank you. Thank you so much for coming in. Someone's from Southern California, my neck of the woods. That's where I am. Welcome, you guys. Welcome, Jasmine. I'm sorry about your dad. So let's get started. Let's start asking me your questions. I'm going to do the best I can for the next hour to answer the questions that you've been thinking of. I just put a new video out today. My videos are going to be 3 days a week now. So if you don't subscribe already, subscribe. That part is free. You can join a membership where you get like I can see who's commenting and stuff. So my members can usually get more questions answered quickly, but it's nothing you have to do, of course. Okay, so Sherry says, do hospice nurses also double as regular nurses? Is it better to choose one that only does hospice? No, so like a hospice nurse is a specific type of nursing, but most hospice nurses have been all types of nurses. Like I was an ICU nurse for many years, and now I transitioned to hospice and palliative care. So it's just a specialty. And I think, I don't think that matters. Thank you, Stephanie. Can a person will themselves to die? My 89-year-old dad is on hospice and seems to be dying from a broken heart, Judy. Judy, I wouldn't say everyone can, but I think a lot of people can. Yes, a lot of people can kind of choose when they want to die or say enough is enough, or frequently, many people, I did a video about this, die soon after their spouse or their loved one of many years, whether it's their dog or a child, just of a broken heart. They do die soon after. That's actually like a thing where like cortisol is actually released, and they call it people dying from a broken heart. Now, I'm not saying that's what's happening here with your family member, but I do think people can do that. Would you ever consider doing something with Caitlin Dowdy? I'm probably saying her name wrong. Ask a mortician. Heck yeah, I would consider that. I consider a lot of things. I keep thinking about, like, should I do something where I interview people like her? Do like a weekly podcast where I'm interviewing someone like a mortician, I found someone on Instagram that I really like, where they're talking about estate planning, all the things you should do to set up your estate planning, advanced directives, things like that, so people can tune in and learn. So I'm definitely down with that. Michelle says, question, my husband is just entering palliative care. We have our first meeting in 2 weeks. What are some important questions to ask? So with palliative care, it's a little different than hospice. So with palliative, it's a little tough because every palliative care program is going to be a little different. So what I would ask is, like, how does your palliative care team support my husband and myself? What are all the things we can do to take advantage of this program? Like, what are all the things offered? And then specifically, if you want to know about your husband's disease, like why he's on palliative care, you can talk specifically about what can I expect with this disease? What do you typically see with this disease? What are all the paths we can take? We want to know this, like all the different paths that someone could take with this disease. So I hope that helps. Thank you so much, everybody who is here. I do not work with death doulas, but I'm totally down. And you know what? I live in LA. I'm sure there's a bunch of death doulas here. And for some reason, I've never worked with any of them. I don't know why. That's crazy. And people who are wondering what death doulas are, think of like birth doulas and what they do, but put death instead of birth. So they prepare and help you with death. That's a very general statement. There's so much more they probably do, but generally speaking. My husband is currently on hospice right now and experiencing some agitation. He has had hiccups, and while sleeping in the afternoon would moan each exhale. What does that mean, Jennifer? So unfortunately, Jennifer, I love how I just fix my bra straps continuously. When I say unfortunately, I mean, unfortunately, there are not always black and white answers for everything. I think that's a lot to do with it. This whole like end of life journey, right? When someone's on hospice, a lot of things are going to be happening. And with hospice, we fix the symptoms a lot of times. We don't figure out why it's happening, right? And that's really hard to live with. I'm a person who likes to know the thing. Tell me why it's happening. Tell me how to fix it. I like answers. And unfortunately, we can't always provide those. So why is he agitated? Why is he hiccuping? Why is he moaning with each thing? It's hard to know. I don't know his diagnosis. Things with the liver, with the pancreas, with the bowels, they can cause agitation to your diaphragm, which can make you hiccup. So that could be why. The agitation could just be, there could be it could be from medication. It could be because he's used to being independent and now he's not, and he's kind of confused. That can make you agitated. It could be because he needs to poop, but he can't. It could be because he's in pain, but he can't say it. So it's a little hard to know. So what I would advise you to do, since he's on hospice, talk to the hospice company, call them, tell them what's happening. Sometimes we don't always get the answer to why it's happening. That is frustrating and that is hard. But what we do want to make sure we do is make sure the hospice company and yourself and the family are helping trying to manage those symptoms. And if he's alert and oriented, or at least alert enough to say, yes, I'm in pain, no, I'm not in pain, ask him, are you in pain? Why are you moaning? Now, if he can, sometimes they can't verbally tell you. So you have to sort of just monitor and talk to your hospice company about that. But if he can answer you, I would straight up just say, like, why are you moaning? Are you in pain? And sometimes people will say no, and they don't know why they're moaning. It just depends, right? But in general, you don't always get black and white answers, which I know is so hard. I wish I could do that. I wish I could give everyone all the answers, and know that you're not, know that that's okay. That's okay too. Sometimes let's just say worst case scenario, right? You took him to the hospital to get the answers. I would say like 9 out of 10 times you won't get answers anyway, because a lot of times there's not an answer. It's just sort of like something's happening. It's a little agitated. It's hard to know. I hope that helps a little bit. Hey, Julie, love your channel. Hey, Mustang68. I was thinking about writing a book on my 3 years in children's hospice. I think that would be amazing. If someone on hospice has something like a heart attack, are they still taken to the ER, Sammy? Not usually, because usually people on hospice are DNR, means do not resuscitate, and they want to die naturally at home. So they usually don't. However, if someone is on hospice for pancreatic cancer and they have chest pain, we would like, because we would know if someone's having a heart attack, right? You'd have to get like tests to know if they had a heart attack. So if they were having extreme chest pain, we'd probably just manage that at home with pain medicine or nitro if we could get it there. Let's just say they were having extreme chest pain and someone called 911 and they did go to the emergency room. They could get treated for a heart attack there if they were having one. But if they did get admitted into the hospital, they would have to come off hospice. You can't go to the hospital and be admitted and still be on hospice. And usually that doesn't happen, but every once in a while. Oh, Sandy, welcome to the membership. Thank you for supporting. Thank you so much for supporting, Sandy. Hi, Vera. I'm so glad you're here. Thank you. I just randomly bumped into your channel. I really think you're doing an awesome job. Oh, thank you. Merska, I'm probably saying, I'm so sorry to everybody who I can't ever get their names right. Unschool. Thank you for the support. My gosh, you guys, you're so sweet. Thank you so much. Okay. Hey, Julie. Abigail Baker says, hey, Julie, as a hospice CNA, thank you very much for being a CNA. We love our CNAs. I generally have to do postpartum care. Do you think it would be better to do postpartum care before family comes, if not already there, or do you wait until after they come? So you know what, Abigail, I am not in a facility. I'm in their home. So I'm always going to their home first. So they've already been with their dead loved one. And postpartum care, as you know, I feel like is pretty hard to do independently sometimes if you're like turning them and stuff. So if they're not already there, I probably would do it. I'd probably make them look presentable, right? And then you can say to them, like, is there anything you could always ask them if they want to be a part of it or if they don't. Some people like the ritual of it, but I think in general, if they're not there, I would just make sure they look presentable, if you know what I mean. Not that everyone dying doesn't look presentable, but like you just want to make sure they didn't urinate or defecate or something. But I think it's okay to do it before they get there. And then if they do get there and they wanted to do it, they can just do it again with you, maybe. I hope that helps. And thank you for all your work. I have a question. When my dad passed away in hospice and his body tensed up as his heart stopped, he took his last breath. Why did that happen? So my answer to this is also, I think, also like I would find annoying if someone was telling this to me. But sometimes, again, we don't always know why. I could sit here and try to give you reasons why, right? Which I will a little bit, but just know that like the reasons I'm giving to you are not set in stone and they're not black and white. In general, we don't know why the body does every little movement it will do at the end of life. And not everyone will do things like that, right? Barbara Carnes, who's an amazing hospice nurse who does a lot of educating, talks about how dying is like a laboring process, which I like that analogy, thinking about that, but I also don't want people to associate actively dying with pain, because the dying process is really natural and not actually causing pain. Diseases you're dying from can cause pain, but like the actual process of dying is not painful. But there is like a process to it, and it's shutting down and it's making the body do strange things, usually unconsciously, because the person, the consciousness is likely either gone or unconscious, right? They are like not fully aware. So it's more of a body doing things. I think because people are having changes in breathing because of metabolic changes in the body, that can cause the body to jerk, that can cause the body to tense up and then suddenly relax, that can cause the body to make noises, rhythmic noises sometimes. I've seen people scrunch their face. I've seen people let out kind of like a silent looking scream. None of those things, although they look alarming, especially when it's your loved one, as a hospice nurse, and I've seen this over and over again, it's not necessarily alarming. So I think it happened because the body is slowly shutting down. And when that happens, the body does weird stuff sometimes. And there's not always like a very specific answer. I hope that helps a little bit. I know. I really wish there are sometimes I can give like actual, like, oh, this is why it's happening. But sometimes it's so general, it's like, it's hard to know. It's hard to know for sure. Okay. Just trying to go back up and look through some of these questions. Melanie, I hope you're still here because I'm going back through the questions here. Melanie says, hi, Julie from Florida. As a hospice took my brother-in-law to a facility. His eyes were huge and jet black. Scared me. He glared at me like he was looking through me. The eyes can do strange things too at the end of life. I don't always see it, but other people do. So I have a video about this. I think I posted it already. Something happens with the eyes that can make them change color and get cloudy. The jet black is probably because the blacks of the eyes are dilating. So instead of constricting, they'll be dilating so they can look really black. But it can look scary. If you're not used to seeing stuff like that, it can look scary. That's why I feel like it's really important to talk about this. So good. I'm glad everyone keeps bringing things up. Thank you. Hey, it's me, Lisa. Thank you, Sammy. I am reading all of your guys' comments about saying thank you and how my videos helped. I really, really appreciate that. I'm sorry I'm not really acknowledging everyone, but I do see them and thank you. Sandy Curtis, welcome. She asks, how can I get my husband to talk about hospice? His first wife died from pancreatic cancer at the hospital. I have stage 4 mets to the brain and to bone. Oh, Sandy, I'm so sorry. This is it's so hard. So what I would suggest if you're thinking about hospice, or even like maybe you're on hospice, but it doesn't sound like you are. So what I would do, if you've been working with a specific doctor, your oncologist, or even your primary care doctor or a nurse you really like, usually cancer centers, if you've been getting treatment, have a social worker and you can have a family meeting so they can help you bring it up and talk about it. If you don't have that or you don't feel like going through all of that, I would say your husband, you know your husband better than I do, right? But most of the time when this is a thing, it's because your husband or whoever loves you very much, right? It doesn't want you to suffer, doesn't want you to go, doesn't want you to die. And they're afraid too, right? So I think coming at it from a vulnerable and truthful place, which I know can be hard, and it can be hard for the husband too, because he doesn't want to go there, right? But to even say stuff like, honey, I know you want the best for me. And I know you maybe are afraid or you don't want to talk about this stuff, but I need you to know that I need that I know this, right? And the best thing to help me not suffer, or the most caring thing, because I know you're doing this because you love me so much, right? Is to talk to me about this. And here's what I am thinking, and here's what I want. Yes, right? So it's like, I know what you want is to care for me. And here is how you can best care for me. And then say what you want and need. So will that always work? No, because people, it won't, but sometimes it will, right? Because it depends on the person. I always say, like, just because someone is dying or has advanced cancer or their loved one has advanced cancer, doesn't mean they're going to suddenly be able to be emotionally available. So if your husband is already hard, kind of hard to crack open, it's going to be hard, right? So if you can get the help from like a social worker or something, get it. But if you don't feel like doing that, I'd say just come to him honestly and vulnerably, and remember that he is just he's loving you how he knows how, right? You can even say that. I know you're loving me how you know how, and I know you just want what's best for me. And here's what I want and need. Usually that helps. I hope that helps, Sandy. Oh, okay, good. And you know what, Sandy? I keep calling you Sandy, and I don't even know if that's how you say your name, because that's not how you're not spelling it, Sandy. Sorry about that. Thank you, guys. Okay, welcome everybody. Welcome. If you're new, I'm Hospice Nurse Julie. Don't forget to hit the heart on the bottom of the screen. I am live at 5 every Wednesday on YouTube, where I can help answer a lot of your questions. Thank you, Judy. How can I be present for my dying mother on hospice if I'm not there in the area? Any advice? Oof, it's really hard. It's really hard. Do you ever, I don't know where she is at in the stage, so frequently trying to call her or FaceTime her, or frequently talking to the nurses and doctors so you know what's on the up and up. I would go see her sooner rather than later if you can physically, right? People are always like, when should I go? It's like, if you're thinking about it, I would go now. Like, it's never I would start going as soon as you can, because you're going to want to be there. But I don't know if she's alert and oriented. I don't know what her deal is. So, I think being present with her in the sense of like having her hear your voice, like if she's not fully able to communicate, but having her hear your voice on the phone or FaceTime, and visiting as frequently as you can, as soon as you can, if you can. I know that's not always possible. And being in contact with her doctors and nurses so they know that you're an active member in the group, even though you're not there. Does that make sense? I hope so. And you guys can talk amongst yourselves too, in the chat, like you already have been. I love forming like a community. This is really good. Rebecca, I'm glad you're here. Rebecca says, my dad's rattle started 2 days ago, but his breathing is mostly clear again. Is that normal? Yes, it can be normal. He no longer talks, has milky glaze over his eyes, and a temp. Rebecca, I'm assuming by you talking like this, he is already on hospice. That does all sound very normal to me. A temp is really normal. The temp usually fluctuates. I usually either use a Tylenol suppository to help with temperature if it seems bothersome, or I will use like cooling measures, like a cold cloth on the forehead, behind the neck, anywhere in like the napes of like the arms underneath the knees. That can always help. To the glazed milky eyes, always normal. Don't worry so much about the breathing as long as he looks comfortable. That's all really normal. The rattle can kind of come and go. Not everyone even has the rattle. And yeah, as long I always say, like in those moments, it's like, is he clean? Is he safe? Is he comfortable? If all of those are yeses, you are good and you can just be with him. And that's it, and it kind of it feels weird. Like, that's it. Don't I need to do more? And it's like, no, you don't need to do more. And how do you know if he's comfortable? If he can't tell you, you look at their face and their body language. So if you touch him and he lays there and doesn't move, that probably means he's not in pain. Now, if he moves his arm or winces or something, he might be in pain and maybe needs some pain medicine. But that's also something you can work with your hospice company with so they can help you. Okay. Nurse Julie, your experience with end of life with pacemakers. Pacemakers are okay. Pacemakers will only work if your heart's still beating, so you don't have to worry about turning those off, or someone's not going to live longer because they have a pacemaker at the end of life anyway. Now, if they have a defibrillator, which means a shock, That will only be like, they will only shock the person if their heart goes into an irregular rhythm at the end of life, like an arrhythmia. But they don't always go into arrhythmia, so they don't always shock. But when they do, it can be rough. So you always want to try to get that turned off, either before coming onto hospice or let your hospice company know. And they usually can do something with like a magnet that will help. Amanda says, hi, my father is in hospice, has been unresponsive for 3 days, hasn't had food or water for 7. He stops breathing, then gasps for air. Is this painful? Does morphine help relax him? Amanda, I'm so glad you're here. Thank you for asking that question. I would ask your hospice team. I mean, I'm still going to answer this, but I want you to know that I would ask your hospice team so they can actually look at him, right, and see. They could tell you better than I could. But in general, from what I hear, I would say he is not in pain from that. That's very normal to breathe and then stop breathing and then kind of like that again. And it feels like they're gasping for air, but really it's just their body. It's like a metabolic change in their body is doing that. But again, I would ask your hospice team just in case to make sure they look for it. So in general, the changes in breathing at the end of life are not painful. Sometimes I will give morphine for people who have changes in breathing at the end of life if it's really rapid and they look like they're like laboring to breathe. And yes, morphine will help relax them. So if he doesn't look relaxed, I would err on the side of giving morphine as long as it's ordered, right? And again, always ask your hospice company because they can actually visually see him. But from what you're telling me, everything sounds normal. Unresponsive for 3 days, normal. No food and water for 7, normal and okay. The body is built to do that. He is not hungry. He is not thirsty. That is not hurting him. If anything, it's helping. And when your body gets into like true ketosis, it's called, which has nothing to do with the diet. So don't associate the two. It does a little bit, but like it's different because they're not eating. But the body goes into ketosis, actually releases endorphins that makes you not hungry, not thirsty, and actually gives you like pain. What am I trying to say? It like gives you pain relief, or like dulls your senses and dulls your nerves to like give you some like analgesic. So it's actually good. And as long as he is clean and safe and looks comfortable and like and when you like touch him and stuff, he's not moaning, it's okay. And the breathing is normal. Again, I'd have to kind of see it, but from what you're describing, it sounds normal. But yes, morphine will help with that too. Morphine helps relax the central nervous system, relax the diaphragm. So you kind of just feel, but I bet even with the morphine, he'd still do that gasping thing because that's just more of a type of breath than him actually gasping. He's not actually gasping for air. It's just a type of breath. Does that make sense? It's not like someone who's like fully alive and feels like they can't breathe. It's different. I hope that helps. Have you ever done a video talking about lung cancer? Can you talk about it? I think I have, but I'll still talk about it. In general, when I think of lung cancer, so if it helps, when I think of lung cancer, nothing really sticks out. I'm not like, oh boy, that causes this and this and this. I do see a lot of lung cancers on hospice, but none of them really stick out to me, which tells me they don't have a lot of symptoms that I usually have to manage. Because if I did, I would be able to rattle them off. So in general, the main symptom with lungs would be pain and shortness of breath. And it's nothing that like sticks out to me like crazy. Otherwise, I'd be able to like picture a person who had lung cancer and like all the things I had to do, and none of that happens. So to me, it's pretty like, which means it's pretty standard, which is good. And means they take the typical, and actually you can live with lung cancer for a very long time, depending on the type and where it is and where, if it moved anywhere. So people can really live a long time with lung cancer, depending. And I would say it's mostly managing shortness of breath and pain. And then the normal stuff that I see with every single person on hospice, which is debility, which means like you're not going to be able to move around and do the things you used to do just because your body's going to get weaker. You're also going to be eating less, drinking less, and sleeping more. All very normal and to be expected at the end of life. Hope that helps a little bit. Have you ever determined that a family member gave too much morphine? No, it's not really happening. I even had a doctor of mine say how like a patient like drank a whole bottle of morphine that they were given and they just like slept really well. I think people really underestimate overdosing is a thing for sure, especially if you're abusing opioids and you're shooting them and stuff. That's a thing. But the amount of stuff that we're giving, no. And we're not really monitoring somebody. If someone's actively dying, we're not really monitoring. Did they give too much? I mean, most families, that's not happening. So that's never happened. No. Do you know if there's a difference in the end with glioblastoma? Rebecca, I wouldn't say there's a difference, but I would say glioblastoma, unfortunately, is one of those diseases that I do see a lot of symptoms and just feels harder. You know, it's usually young. They're young people. It's usually young men. Not always, but usually. And so it's like young. It's been a journey. They didn't want to go on hospice because they're young, right? There's usually seizures. There's a lot of mental, like they lose their mental capacity because it's a brain tumor, right? So, and then they're on a bunch of steroids. Like all these things actually help. Like they're on a bunch of Keppra and stuff so they don't have seizures, and then steroids to help with the inflammation, like a bunch of things. That can help, but they're still just, they're young and they're debilitated and they don't usually want to die, which many people on hospice who are elderly are kind of like, hey, I've lived a long life. But when you're younger, that's a lot of harder pill to swallow, right? So there's a lot of existential stuff going on and there's some pain and it just can be harder. It just can be harder. Now that's not to say we can't do anything about it, right? The hospice is great at managing all of those things and we're experts at it and we do. And we see many people with glioblastomas that we manage very well. It's just usually sad, it's extra sad for everyone. But again, I do think hospice is a good place eventually for people with glioblastomas and we do a good job at trying to manage it best we can. I hope that helps a little bit. I would always recommend people, side note, this real quick. I would always recommend people with like something like glioblastoma or ALS, dementia. I mean, anyone really, but specifically, like, I think those are like, can be harder diseases, I guess. And I think finding support groups and other people that have gone through that or who are going through that will be really, 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 really beneficial. Really, really beneficial. So just my 2 cents. My mom has severe dementia, still feeding herself, although I said it's horrible. I do everything else for her, 4 years now. She doesn't recognize having to use the bathroom at all. Is this normal? Yes. I'm sorry, I don't have more of a answer for you. It's normal. It's just really hard. If there's anyone on here, I feel like 24-hour caregiving for somebody like with someone with dementia, I liken it to like being a parent of a toddler or a baby. And you're overwhelmed and you're tired and you're like, how is everybody doing this? Am I going crazy? Am I doing something wrong? Why is this so hard? You're not going crazy. It's just that hard. It's just that hard. And if you can use any type of resource, if you have, first off, if you have the money to use a resource to have someone else help you, do that. Don't let yourself get burnt out. If you don't have the money, which most people don't, I would look into any kind of social worker that you work with to help you find programs that are possibly in your community that can help you, or any family, neighbors, friends, anyone. Take the help. I know it's so hard. I know it just feels like, oh my God, it'll just be easier if I just do it. Take it. Take the help. Take the help. Ask for someone to bring you coffee. Ask for someone to come over and watch your loved one for 45 minutes so you can go for a walk. You have to do it. And I'm telling this to myself too, because I know it would be hard for me to do that too. But it's just hard. It's just hard. And thank you for all you're doing. How do I celebrate my first birthday without my mom and dad? Chris. Oh, Chris, how do you think What sounds good to you? That's what I would say. What sounds good to you? Even if it means like nothing sounds good to me, I'm pissed, I'm angry, I'm sad, I'm crying. Okay. You know what I mean? Like, yeah, do that. I always think I personally like to do things like I like to write. So I would like to go to the beach and like write a letter to them about what happened in the past year or like how I miss them. Doing something in memory of them, planting a tree. I always love a good tree planting because then you can go back and watch it grow. So things like that too. But also like what feels good to you? What feels good to you? I have a question. Sorry, one second. Hi, Gail. Nice to see you. Oh, thank you, Gail. Nice to see you guys. Thank you so much. Hi, Julie, fellow SoCal RN here. Woo woo, looking to get out of the ER and into hospice. What should I look for in a reputable hospice agency? Kim, if you're in Southern California, look for an agency that's unionized. Look for an agency that's unionized. Your life will be so much better. If you can find a hospital or an organization that's unionized, look for that. That's one. Two, look at their caseload. RN should only have 12 to 15 patients at a time. If they don't, something's wrong, unless they have an LVN helping them, but even then it's too hard. Ask them about their weekend policy. Ask them about how many patients they expect you to see in a day. 4 to 5 should be the max. 1 SOC a day should be the max. So things like that. Things like that. But you'll be a great hospice nurse, and ER nurses will be great hospice nurses. Bear with me here. Welcome everybody, by the way. I'm Hospice Nurse Julie. In case you're new here, there's a heart button at the bottom of your screen. If you can tap a lot, that'll help me. I am here every Wednesday, live at 5, where I'm going to be answering all the questions I can for the next hour or so. Can you compare hospice at home versus going to a place? I have metastatic ovarian cancer and I live alone. I'm in remission right now after second remission. Oh, Janet, that's amazing to hear. Janet, if you live alone, I would recommend when it truly does come the time and you're truly debilitated and can't really care for yourself, if you can afford to pay for someone to live in the house with you and take care of you, which is very expensive, but you know what? More power to you, girl. If you can do it, pay for that. If you can't, I would go to an inpatient hospice center because it's just going to be too hard for you to try to do it alone. And it's really hard on family members unless you have like multiple to kind of do it all for you, because eventually people will need full care. So I feel like you don't need to think about it right now. You don't need to deal with that right now. But in general, either pay for someone to be in your home. And it's not because the hospice company won't provide 24-hour care. So you can have hospice in the home, but then you're going to need to pay for a 24-hour caregiver to be there because the hospice will not provide that. Or if you can't provide that for yourself, which most people can't, so it's okay, I would go into a place that can take care of you, and then the hospice will either go there or it'll be a hospice home, if that makes sense. Someone just gave me $10. Christy Lee, thank you. Just wanted to thank you for all you do. I'm 40 with spina bifida, seizures, 68 surgeries. Wow, so much. I recently started a channel to educate and build a supportive community for people with health issues. Chrissy Lee, that's amazing. Thank you so much. And thank you for being here. And thank you for the $10. You're so sweet. Gail says, my husband takes care of his mom. She has dementia. He has asked me to come over to help, but I don't want to. The reason being is because of our relationship has been very abusive. Gail, good boundary setting. Good boundary setting, girl. You don't need to go do that. If you have an abusive relationship, I don't know if it's with your husband or with his mother-in-law. I don't know which one is abusive, but either way, if someone's being abused, you don't gotta do it. Hi, Epic Roller. Nice to meet you. Yes, Freebird. It is the hardest thing. Welcome, everybody. Thanks for all who are here. 334, you guys. Next week and next Wednesday, set your alarms if you can for Wednesday, 5 p.m. live, because I'm going to have, let's see, am I good? Yeah, I'm going to have an announcement. My biggest announcement yet will be Wednesday, live at 5. Some of you could probably guess what it is, but just in case. How long can you live with COPD? A very, very long time. Very long. 15 years, 20 years, depending on how severe it is. Thank you, Nikki. I'm glad you're here. Megan with my faces. Megan is part of the membership program, and she always does, you get these like little emojis of me, and you're the best. I don't know why I drink Topo Chico when I'm live, because now I just can't stop burping. Are you pregnant? I am not pregnant. You're getting married, aren't you? No. You guys! I'm just realizing you guys are talking about my surprise. No, I'm not pregnant and I'm not getting married. It has to do with like Hospice Nurse Julie stuff. However, my gosh, wouldn't that be exciting to be getting married and getting pregnant? But I'm not those things. But I think that's the best thing ever. That's what you guys said. It makes me so happy. Listen, if I'm getting married and I'm pregnant, you guys are going to be the first to know. I promise. But that's not it. That's not it. Global Vagabond. You know what I want to say to you? Thank you for your commitment. I appreciate you because I feel like you have been here a while. I have the federal long-term care plan. It seems a small price to pay to help, even a little bit if needed. I don't get why so many people avoid it. Have you seen people benefit from long-term care insurance? Not really. That is, I honestly, I have the same question as you because I always think that's what people should do, but I also haven't seen people really benefit that much. But I got to be honest, this is why I want to start like a podcast or something where I interview people who are experts in that area. And I'm not. So it could be a really good thing to invest in. I just don't know it. I don't know. But I want to like find people who do know so then I can tell them. So I'm sorry, I can't answer your question. Thank you. Thank you, 1960 lady. Julie, are you getting a puppy or a kitten? These are all good guesses, you guys. These are all good guesses. I'm not getting a puppy or a kitten, but if I were to get a puppy or a kitten, I would choose kitten. Don't get too mad, all you dog lovers. Hi, Julie. Thank you for all you do, taking care of my aunt with dementia. Not sure if you can answer, but are there options to Ativan for dementia patients? So you could try to give Ativan to dementia patients, but they don't always do well. So I can't really give you specific medical advice for your aunt. I would recommend you talking to a doctor, her doctor specifically. But I will say generally, there are many things that we can give to dementia patients because the Ativan would relax them, right? There are many, and sometimes Ativan doesn't work very well for elderly people and people with dementia. But sometimes it does. So that's good. But also there are other medications like Seroquel or Remeron. There's tons of medications that can help relax someone with dementia. However, I can't specifically obviously speak for your aunt because one, I'm not a doctor, so I can't prescribe things. But in general, I would talk to the doctor. If you see that your loved one with dementia is getting really agitated or getting really agitated at night with sundowning, there's definitely something they can probably give them. Now, it is a time when you have to be patient and kind of try different things, and sometimes they'll work, sometimes they won't. It can be really frustrating, but eventually it'll probably get on a good regimen where it can be helpful. Thank you, 1960 lady. David says, "Hello, Julie. I enjoy watching your channel. I was wondering why patients who are on dialysis treatment have a limited lifespan. Doesn't dialysis treatment take care of end of life kidney disease? It does, and it works for a very long time. And people do live a pretty regular, ordinary, normal life once they're on dialysis." As long as they don't have other extreme health issues. So sometimes, along with end stage kidney disease, which is why people go on dialysis, there could be other issues. There could be heart issues, there could be lung issues, there could be liver issues. So they could be sick in other ways. And that could be why, even though they're on dialysis, they're still not thriving. But a lot of times, people can be on dialysis for 10, 15 years and live a very normal, thriving life. But eventually, you have to stop dialysis because your body can no longer handle it. Eventually, it gets too difficult, it gets too hard physically, and your body really can't handle the fluid shift. Things just eventually it stops working, and people say, enough is enough. And they go off dialysis and they die a very, very peaceful death, usually in 7 to 10 days. So, end stage kidney disease, I would say, is one of the most peaceful deaths you can have. Now, getting up to that point, and depending on what other kind of issues you might have, will make a difference. But if you are clearly just stopping dialysis and then choosing to die from end stage kidney disease, it's usually very, very peaceful and painless. And you mostly are confused and sometimes itchy, but you mostly are just sleeping until you fall asleep, until you die. So, but it is generally very peaceful, but it is quick, 7 to 10 days once you stop dialysis. Do you think it's become more socially acceptable for patients to choose to decline treatments for progressive diseases and accept hospice instead? I hope it becomes more. I don't know if it's really acceptable. I feel like it's not even offered. That's the thing I have a really hard time with. Like, I just want people to know their options. I'm not saying, like, oh, you have to choose hospice. I just want people to know that they don't necessarily have to do X, Y, and Z treatments. And what does it mean if they don't, right? That's why I always want you guys to ask you, if you get diagnosed with some kind of cancer, whether it's terminal or not, like I may as well, I would ask, okay, what are my options? There's surgery, there's surgery and chemo, there's surgery and chemo and radiation. What else? What if I choose not to do that? What's that going to look like? And I will say, a lot of the treatment for certain cancers are very beneficial for symptom management. So it's like, yeah, why not do all the things, right? But just knowing that the doctors know that you are open for that discussion. You want to discuss it with them. So I don't know if it's more acceptable. I don't know about that, but I'm hoping it starts to become that. And all you guys being here will help with that. So thank you. My doctor told me that if I didn't have the radical hysterectomy because of my cervical cancer, that I would die a painful death. Is that true? There we go, holy fire. So I can't say for sure because I didn't see your scans or anything like that. But a lot of times, the things that doctors are offering you, like different types of surgeries and things, will be beneficial. Will be beneficial as far as like managing pain and suffering. They will be. I'm not the surgeon. I'm not, so it's hard for me to say for sure, but I would say there are certain specific diseases where it's like, yeah, you probably should get this stuff removed because it's going to make you feel better. Maybe not make you live, right? Maybe not make you live or live forever, but it's going to make you feel a little better. So I can't say that's not, I would say that's true. I don't know for sure though, but I would say it likely is. What's your opinion of HDC at the end of life? Do you feel it's a life-saving measure or does it prolong life? Oh my gosh, Edna, what is HDC? I don't know what it is. Can you tell me what it is and then I'll answer this? John Roberts, you're the best. Julie, your work seems sometimes emotionally consuming. How do you unwind from seeing dying patients frequently? I have to be super transparent here. Even before I started doing social media stuff, I was a per diem nurse, which means I only worked when I only owed the company I worked for 4 shifts a month. Now, granted, I usually worked 4 shifts a week, every week. So I was still basically full time, but I could kind of come and go, right? I could work 4 shifts this week and then 5 the next week and then 2 the next week and then 4 the next week. I could kind of come and go, take a week off here, and that really gave me a lot of freedom to not feel burnt out. And not feel burnt out. Like there was something I didn't have to do on call shifts. So something about that really, really helps, really, really helps. And I think because I was an ICU nurse for so long prior to becoming a hospice nurse, I truly feel like it doesn't feel depressing to me because death doesn't feel like the worst possible answer sometimes. Suffering feels far worse. And I saw a lot of suffering in the ICU, and I don't see a lot of suffering in hospice. So it doesn't feel as draining as you'd think. And I have a really good work-life balance. I really do. And that's really hard to have as a nurse. But because I work in Southern California, because I work for because I'm per diem, because I work for a unionized hospital, it's really, really helpful for me to have a good work-life balance. When I was a full-time non-union hospice nurse, it was tougher. It was tougher. It was a lot more work, and it was harder to feel okay all the time. But now I really do. I really do. Mustang 68 says, when my mother entered hospice at home, it took me 2 days to get home. After arriving, I found her morphine missing doses. Her nurse and I found out why. Please discuss this issue. Why was it? So I honestly, Mustang 68, we do provide a lot of narcotics and a lot of things that a lot of people abuse on hospice. And I have to say, very rarely do we run into the problem where someone else is taking it or someone stole it and we have to figure out what's going on. Every once in a while we do, and we have to file a report because it's illegal. We have to make sure everyone knows what's happening. And then we have to unfortunately, watch that family, watch who's coming in and out. And we have to be really strict on like, when was the morphine given? Write it down. Who gave it? How many do you have left now? When's the refill due next? It's really, really unfortunate that we have to be so, but honestly, that rarely happens. That rarely happens with me. But it is a risk. And that's why like nurses can't run around carrying this kind of stuff, because we don't want to be a target for people to steal from us. We found out the issue is bigger. Oh boy. Oh, West of Oz. I hope you're still here. My partner died of bilateral pulmonary embolisms. I'll explain what that is in a second, guys. I feel that I didn't pay attention to the symptoms soon enough, just hours before he died. Had I acted sooner, could have he been saved? I have to, so of course, I want to be able to say, like, I wish I could have all the answers for you to relieve you of that pain and guilt. One thing I can say is that it's very normal for you to be feeling that way. And I feel like it's almost easier than to have to deal with the pain of someone being gone, to like ruminate on like, what if this, it almost like keeps our brain busy, but I will say pulmonary embolisms, even one of them, which is a blood clot basically to the lungs, are deadly, kind of like no matter what. Like the only reason why I saw so many of my patients live through pulmonary embolisms is because they were already in the hospital, right? So even if you would have found them sooner, would it have been soon enough, right? Like 5 minutes, 10, like when would have been sooner? And how are you supposed to know? You know what I mean? In general, PEs or pulmonary embolisms kill people. It's unfortunate and it's horrific, but that's true. Whether you found out soon enough or not. And really, the only reason why none of my patients really were dying of pulmonary embolisms when I was working in the hospital is because they were already in the hospital. They were already there. so we could start interventions right away, right? I hope that helped a little bit. I'm so sorry. It's so hard. It's so hard. Chrissy Lee, I think I think you know more about, your disease and how you live with it, right? So I think you should talk about on your channel anything that you feel like is important to talk about, and maybe just your experience. I always think I feel like I always think coming at anything with truth and authenticity, right? Just being yourself. Like, I'm sure you have things you want to say. So just say the things you want to say truthfully and authentically, and people will listen. People need community. So they'll be looking for you. So that's it. Just talk from your heart and say the things that you think are important, things that you think are important people know. Three more minutes, unfortunately. 3 more minutes, then I gotta go. I got a hard out at 6. What's the hardest part emotionally of what you do? The hardest days are the days where I feel like where you feel helpless, because like sometimes I arrive to people's homes and they're having active symptoms, active shortness of breath, active pain, active agitation, and there's nothing in the home to give them. There's no medications there or anything that'll work anyway. So we have to order all the things. And no matter how quickly we order them, it's still going to take a few hours to get there, maybe a couple hours. And sometimes that's not quick enough. And you're there for 2 hours just watching them suffer. And that's only happened a few times in my career, but those days are the hardest days and they take me down. I don't know if there's other hospice nurses in here, but tell me if you know what I mean. Those days, it's like I can't go to work the next day. I'm like in my bed, I'm crying, like I can't. Those are the days when like it's like those are the days that are really, really hard, where I feel like I had one the other day. I made a video about it where like I basically watched someone die in front of my eyes, which I've seen before, but like not die well, and their symptoms weren't managed because I got there, their family didn't realize they were dying. They were, by the time I got things ordered, they were already gone. And they died with shortness of breath and pain, and it was just super sad. And there was nothing really we could do. And they didn't want to go to the hospital. They refused. They wanted to die there. They knew they were dying. They didn't want to go to the hospital. And it was just so sad. But that rarely happens. But on those days, it really does take me out. Candy, I didn't see your question. Shoot. I didn't see it. Ask it again in all caps. Reverend Howard Slayton, I want to see this. Can you die from neuropathy? No, I don't think so. And are people who are on hospice because of neuropathy? No and no. You can have neuropathy and it's painful and awful and hard and not good, but you don't die from it. And you can't be on hospice because of it. At 38 with ovarian cancer, do you know the survival rate? Anne Marie, I don't. It really depends on certain things with ovarian cancer. Ovarian cancer is not like the best cancer to get, but it depends on like when you find it, what stage you're in, the treatment, and many people can live many years after ovarian cancer. It just depends. Candy, I want to see your question. I don't see it. A few more minutes, folks. A few more minutes. Or really, 1 more minute. I'm going to try to find Candy's. Shoot. All right, you guys. Okay. So it's 6 o'clock. I have to go. Next week, Wednesday, live at 5 p.m. Pacific Standard Time. I'm in California. I'll be making a big announcement. And Mustang 68, thank you. I don't have time to answer your question. Did you ask me another question? I'm sorry. Thank you all who have joined. Subscribe to Hospice Nurse Julie. That is free. So you can subscribe for free. I post videos 3 times a week, and then I do lives once a week. And what else? A big announcement next week. I guess that's it. You guys are great. Thank you for all my membership people. Thank you for people who donated money. You guys are amazing. And actually, maybe what I'll do is my memberships, I will tell you the surprise before Wednesday. I got to do something special for you guys. Which this is not a ploy to get you guys to do the membership program, but it really isn't. It really isn't. But if you're already in it, I should give you a little treat, right? Anyway, okay, you guys. Thanks, Team Timmons. You guys are so cute. Okay, I really gotta go. But you guys are the greatest, and I really appreciate you being here and all your questions and all your support. I'll see you next Wednesday. You're the best. Keep taking care of yourself and your loved ones. Love you guys.